I didn't even bring my computer, I told myself.
Okay. Yeah, I'm about to shut this off. I'll leave it now. So check his emails that were going this minute.
I am. Did. I was one of the first ones in Johnson. Good, how are you?
Definitely. We have a sign seat. No, we don't have a sign seat. Hi.
He's got something over there too.
Oh, maybe you already took it.
Yeah.
So yeah, now he has 2 copies of something. Well, I had the report back. Just to read it and get it back to me so I can do any changes.
Well,
before
my
retire.
question, how many days? I've got
4 days.
my question.
I did that once.
Huh?
I did that once for 30 years, in the Marine Corps, and I was like, I'm done.
You couldn't do
I'm older.
so, but she deserves to retire.
Right, you earned
because
it.
that's what she wants to do.
Right.
And I'm old.
Wait a second.
You know, I'm old. Right, so we're all old. Okay, we'll accept it.
It's so long. 4 years.
That is.
The North Carolina Governor's Working Group on Veterans, Service Members, and their families has deep roots in the Tar Heel State going back more than a decade. Today, it offers a home for the dozens of groups in the state focused on improving veterans' lives and provides a canopy of relief for hundreds of thousands of North Carolina vets. The GWG is a living, breathing apparatus of service, providing a space for veteran advocates to find new ways to better serve those who have served our country. The first seed of this awesome idea was planted in 2006. Among the founders, Flo Stein, Dr. Harold Cudler, Dr. Wei-Lee Fang, and Dr. Mike Lancaster. Over the next few years, the roots of what we now know as the GWG began to take hold, and by the early 2010s, that seed had grown into a sturdy sapling. Heavy-hitting state agencies, such as the Department of Health and Human Services and the Department of Commerce, had come on board. The Department of Veterans Affairs was fully engaged, and nonprofit groups from across the state were getting to know each other, meeting, and finding ways to work together to make veterans' lives better. In 2013, NC for Military Employment was created, NC for Me, an offshoot of the Department of Commerce. In 2014, the organization officially became a working group, before it had been a focus group, and a number of today's mainstay service providers got their start, among them Operation Home, a group committed to ending veteran homelessness, NC Strive, which helps address veterans' educational needs. Also, the first Women's Veterans Summit and Expo was held in 2014, and Veterans Experience Action Centers were established around the state. The following year, another group that's now indispensable was born out of the GWG, NC Serves, which today serves more than 13,000 veterans in 80 North Carolina counties. Also in 2015, the state doubled down on its commitment to vets, creating the Department of Military and Veterans Affairs, which promptly joined the GWG. A large part of the group's success can be traced to its unwavering commitment to key veteran issues, like curbing veteran suicide and ending veteran homelessness. Those critical missions were at the core of the seed planted in 2006 and remain central today. In 2012 and again in 2015, the group published statewide suicide reduction and prevention plans.
These are a lot of good guys, but if they're sitting at home, kind of...
Over the past 3 years, the GWG has become a showcase for veteran-oriented videos and digital media outreach,
I am sober.
including an original series called Words to Live By. battle-hardened veterans speaking directly to other vets, encouraging strength and resilience. Today, the GWG meets once a month to highlight pressing veteran issues, explore new solutions to veteran problems and challenges, and build relationships that turn ideas into action. Representatives from dozens of groups across the state make the monthly trek to Raleigh for the 2-hour meeting. Many more watch online. Each meeting is streamed live, offers closed captioning, and allows for viewer engagement. New ideas like the Governor's Challenge are introduced and given space to grow. Ideas like helpncvets.org are showcased and offered up to the group. Help NC Vets does just what it says, helps veterans and their families get connected to services in the state and connect with each other. Because of these and other efforts, veteran homelessness has turned a corner over the past decade. The veteran suicide rate in North Carolina is significantly lower than the national veteran suicide rate, and the Tar Heel State has boasted one of the lowest veteran suicide rates in the Southeast for the past several years. From its humble, passionate beginnings, the GWG has grown into a mighty tree of veteran support, and it's only getting stronger. Every year, the ground in which it's rooted gets richer and its branches grow longer. New fruits of service spring up, and more relief finds its way to North Carolina veterans and their families. The North Carolina Governor's Working Group can and should be a model for how to meet that mission around the country. I don't even know how much of this we're going to use, but let's find out.
Okay.
Yeah.
I'm Mark Edmonds. I'm the Chief Operating Officer for the Division of Workforce Solutions within North Carolina Department of Commerce.
Hi, I'm Martin Falls. I am the Deputy Secretary for the Department of Military and Veteran Affairs of North Carolina.
My name is Mark Belos. I'm the Director of the Winston-Salem Department of Veterans Affairs Regional Office.
Hi, I'm Deanne Seekins. I'm the Network Director for the Mid-Atlantic Network, DISN 6.
I'm Dr. Michelle Laws, and I am over community engagement and empowerment for the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services.
I'm a 28-year Army veteran. I come from an Army family. My wife, my brother, my father, my grandfather.
I spent over 30 years in the Army. I went from a private to a colonel.
My father served in the military. He served in the Army.
I have a husband who's a veteran. I have a father who was a World War II veteran who used our healthcare system. And I have a son who's enlisting in the military next week.
You're talking about my passion. That's what you're talking about, my passion. What do we do here? We advocate for veterans and for the military installations within North Carolina.
I am responsible for veterans care in North Carolina and Virginia, provide service to about 500,000 unique veterans.
One of our overall objectives and missions is to increase the usage of our benefits. We are getting out around the state to educate veterans on what entitlements they may be eligible for.
Our division has invested millions of dollars to make sure that veterans have access to the appropriate mental health, developmental disabilities, and substance use disorder services that are needed. We want to make sure that no veteran is sleeping under a bridge. We want to make sure that not one more veteran dies by suicide in North Carolina.
So our part of the Veteran Support Network, this collaborative, this network is the job piece. And so we match veteran job seekers with employers. That's what we do. Any veteran that comes into the office gets priority of service. So they go to the front of the line for any job seeker services. They go to the front of the line for any funded training. They go to the front of the line for any employment services and to get them jobs.
We work hand in hand with Commerce, Department of Commerce, and Workforce Solutions in particular.
We can't do it on our own in the Department of Veterans Affairs. We have to collaborate and work with other people.
The Governor's Working Group is a great venue. You've got federal, state, local government, you've got civic organizations, you've got veteran service organizations, such as, the Veterans Foreign War, the American Legion. All those are partners.
One thing that sets veterans aside, the whole veteran community, is we leave no man or woman behind. And I think everybody takes that seriously. And so when you look at groups like the Governor's Working Group, it allows us all to come together and really help veterans that are in need.
What I've really appreciated about our Governor's Work Group is we've been able to walk hand in hand and focus on issues, suicide prevention, suicide awareness. That is something that no one healthcare system, no one community partner can solve alone.
It's really exciting. Sometimes being with the organization I've been with for so long, you get used to doing things the same way. This is an opportunity to do things differently.
And one of the things I'd like to say as a result of the Governor's Working Group is North Carolina is now below the national average of veteran suicide rate. Second thing is North Carolina is below the national average of homeless veteran rate. So I can only attribute that to information, education, and collaboration.
Everyone has their niche, right? No one knows everything, and some of us specialize in very narrowly focused areas. And we believe that if we can pull all of these resources together and this expertise together through sharing of information through the North Carolina Governor's Working Group, sharing information, letting people know across the state what programs and services exist, then that's really key. That's critical.
Well, first of all, good afternoon, everyone. And as usual, I want to bring you greetings from the 75th Governor of the state of North Carolina, Roy Cooper.
Every day, there's a win somewhere, if you look at it. And that win keeps you going the next day, and the day after, and the day after. That yes, perseverance does work. And it makes it all worthwhile.
forward to having her back as your moderator, because nobody wants to look at me for 2 hours. I'd like to start out with something very special today, and we're honored that Secretary Walter Gaskin is here to make presentations as the chairman of the North Carolina Governor's Working Group on Veterans. Today's a bittersweet day. We are losing Dr. Weili Fang, one of our esteemed founders, and she is retiring. So here to thank her for her very, very hard work and dedication is Secretary Walter Gaskin, Secretary of the Department of Military and Veterans Affairs.
Now, let me tell you this. As I told, I think I told you before that at the beginning, that in the military I'm used to retirements are a request. We don't know about a will or leaving, but it's really hard to thank you for all that you've done and the vision that you had during this time to put us where we are, and because of you, we're on good footing, and we're getting everybody to realize how you help is action more than just words and everything. And I also have a saying that dreams without money is a nightmare. So we appreciate all that you've done and to help us get funding as well as the actual process. So we'll start with you, Dr. Fang. Dr. Fang, we're gonna thank you, and you want me to read these words that we said for you, because this is so precious. And for everybody to understand, I also told her that half shot will travel. So okay, some of you, I really want to hug her for that. And it says to the North Carolina Working Group on Veterans, service members and their family recognizes in gratitude for your vision, determination to close gaps in the community service to veterans, enrich the lives of veterans and their families, and establish a statewide infrastructure committed to the well-being and care of North Carolina veterans. Your unyielding dedication, engagement with the community, leaders and policymakers enable North Carolina to lead the nation in developing collaborative partnerships, empowering our communities, government agencies, nonprofits to help veterans access essential services when they needed them the most. Awarded on this day, June 24th. Signed by me to you. Thank you so much. Let me turn around here so we can get a picture.
Words, say words.
Yeah, sweet.
That's a first.
Not always the speaking. The clock here. So, some of you probably wonder why Leah is so interested in veterans, but her father was also in the service. I don't think she's ever told you guys this. He was in the Nationalist Chinese Air Force, am I right? And when the history was very rough, when Mao came and the Nationalist Chinese had to leave the country, and I think your dad flew the hump.
He did, well, he didn't actually fly, but he did go over the hump, which is pretty amazing.
Yeah. And he came to the United States after that. I'm glad you and we're happy.
Okay, thank you. Again, remember now, this is just a request. We reserve the right to call you back.
Absolutely. It has been the most rewarding work that I've ever done in my life. So I've just really enjoyed the work with the people and doing what I think is good for the veterans and their families.
Thank you so much. Again. Okay, Ms. Blow.
No.
Yes. Oh, I know you're not going. See, so that confirms. That confirms. Yes, I took back. That confirms.
Can I stand up?
Yes.
See if I can.
Basically, words singing because y'all
So you don't have to read it again.
I know, but I'm gonna get. She's gonna get a chance to tell us her story too. How you connected to veterans to do such great work.
Well,
Lee and I and my husband ended up in the basement of a big hotel in Washington D.C. about 2006, when SAMHSA and the Department of Defense and the VA decided something different had to be done for people coming back from OEM and enduring freedom than happened to Vietnam veterans. My husband, a Vietnam veteran, we went in that basement and everybody talked to us about what could you do back in your states, and we did it all.
Not without your help.
Well, I'll tell you,
And the money.
And Harold.
And my link. I talked to Mike yesterday.
And see, Dynamic Dual, the Turner, 3 Musketeers, I mean, we
That's true.
really
Thank you.
what you did, and this is just a small token of
Oh,
recognition.
no, don't take pictures.
We'll always be on call.
That's right.
Okay.
I thought this is where Lee.
Oh, no, that's.
There's always more surprises that the governor's working.
Well, thank you.
All right, where are you? Hey, go.
Oh,
Come on.
But you didn't wear your tie.
Let the rabbit out of that hat. This is the new business look, so he's there.
I'm not really
You
here,
have
I'm
some
virtually
fun?
here.
Okay, so now you two, since the words read the same, great appreciation and undying devotion that you put into this, we want you to tell us how you got started into helping veterans. So crazy.
Well, it takes an entire psychoanalysis.
We bring it down.
But the very short version is that my mother named me after her father, who had been a doctor in World War II, joined the Army Medical Corps after Pearl Harbor Day, and died in the course of the war. And she made damn sure I'd be a doctor, but she wasn't so crazy about the VA, because my family didn't have a great experience with the VA back in the 1940s. Nonetheless, I found it very satisfying, and when I had this opportunity with these people, I'm just lucky to tag along for the ride.
And we're glad that they tagged up with you, and this is great, and we just want to recognize you for that.
I never expected it. Gee whiz. Now we are a club. We're
Okay, good. Thanks for taking care of that. Have a seat, ma'am.
Thank you.
All right.
It is, it was a gift, actually.
Thank you very much, everyone. This is a long time coming, as Flo mentioned. Their personal dedication and hard work started in this field in 2006, and without them, we literally would not be here today. And to face it, veterans' activities in North Carolina would be very, very different, and not certainly much for the worse. So thank you all very much for your mentorship and leadership and friendship along the way. Very grateful for it personally. All right, so am I not smart enough to click? There we go. And here we are. I would like to welcome back Secretary Gaskin to the podium. And sir,
Well, first of all, everybody, welcome. Glad we're here. We will continue in the light of what you start, carrying on the business of helping veterans. And enough said, just let's move on.
Let me put it better in the words of Secretary Walter Gaskin. All right, back on your heads, get to work.
all right. And so volunteering is Colonel Falls. And here you go, sir. I've got you all. You got to come up here to the podium for the camera for the folks. We've got.
Well, I don't know if that's good or not.
Oh, we'll be good to go. We've got your. And I'll even click for you. How's that?
Okay, thank you. Thank you. You know, I'm an Army guy. I can only do one task at a time. Thank you. No, what a great day to have the founding fathers of this esteemed, or I guess we're going to call it working group, but this business that we do of bringing all the heads together for a better solution for the citizens, veterans of North Carolina. And that's it right there. Thank you very much. You had the foresight to see that, and now it's our task to carry on. But I'll go back to what my boss said earlier. Retirement is only a request. So you never leave. But I'll get back to it. And it is a great day. Things are opening up a lot better. And a couple things I'll say is, our department is returning to our work site, effective 1 July. The governor has put that out. And we plan on doing that, opening it up to serve our veterans face to face again. And talking to our veteran service officer managers and all throughout the last 2 weeks, they're itching at the bits. They're pawing in the ground to get back to work, to see the veterans, help them, and get out there and do the outreach that we're accustomed to prior to 17 months ago. So we're ready for it. I will say one thing, we're not out of the pandemic. I will encourage everyone to get their vaccination. We have got to get the vaccinations to get this state fully opened up, and let's get back to, the full benefits that we're accustomed to. And another thing, House Bill 83 passed the House, which is the tax exclusion for military retired pay, and it's now in the Senate's hands for their action. So good day on that. We're looking forward to that, and hopefully that too will pass. I know there's been a lot of comments from military that, once they retire, we're leaving the state because, Florida does not tax the retired pay, and other states are doing the same thing. So North Carolina has picked up on that, and we're moving forward with it. I know this morning we had a great meeting with NC Serves, with the Governor's Institute personnel. I know Dave Roddenberry and Brandon both were there and shared a lot of information with our department and ways of moving ahead to bigger and better things. So we're absolutely thrilled about that. And I want to thank those gentlemen for their time of giving to us this morning. Thank you very much. What's coming up? Completion of the Kinston Nursing Home. We're looking at late fall before we open. Its substantial completion is almost done, but the devil's in the details. So we're getting into the detail realm of it, of getting that completion there. But we do look forward to it opening, and there will be an announcement once we do that final grand opening that we're planning on doing. A couple things I want to bring your attention to is the Veterans Health Benefit sessions with the VFW that's going on. There's a brainchild that came out, and we all jumped on board with it. It's all but the VA benefits there, but it's all the same thing. July 17th, you can see is Southern Pines, VFW Post 7318, the Fayetteville VFW Post 6018, and the Indian Trail VFW Post is 2423. Those are all July 17th, just to reiterate that again. And also on July 24th, the Jacksonville VFW Post 9133, we're having that benefit session that veterans can come in and talk of what they need and what they're looking for. And we do anticipate the public engagements resuming, getting the schedule out to do our VACs again, to do full-fledged stand down. So that's on the horizon. But again, please get your vaccination so we can have these events opened up. Get your vaccination. So I'll say the takeaways. Governor Cooper has relaxed some of the standards of the COVID-19 pandemic because of the vaccination rate we have in the state. But we're not at that point yet. So get your vaccination. So that's 3 times I've said it. Get your vaccination. We're going to use our safety precautions, continued that, and it's like I told the VSOs, do what you're comfortable doing. If you want to wear a mask, but you've been vaccinated, that's fine. If the veteran wants to wear a mask, it's available to them. So, let's do this in a way that everyone's comfortable doing it. It may be a little bit different from what we're accustomed to pre-March 2020, but hey, let's let's get the services out there and get it done, get the business done. Again, there's the second bullet. Encourage everyone to get vaccinated. 4 times. Stay vigilant with your 3 W's. Regardless, there hasn't been any flu this year, or none to speak of. And how do we attribute that? Look at the 3 W's, and maybe we can attribute it to that. And as I say, as we open up to facing the public again, we've got new techniques, TTPs we call them in the military, tactics, techniques, and procedures. So, do what's right. Do what's right. Do what you feel comfortable doing, and just be open and honest about it. And let's drive on and get your vaccination. Thank you. That's all I have.
Thank you, sir. Next up, we are going to have, live via Zoom, updates from Brian Ward at the Regional Office, Benefits Office in Winston-Salem. And Brian?
Good afternoon. It's a pleasure to be here today. I've got a few things to go over I wanted to update you on. First one is about compensation pension examinations. I believe, as you are all aware, due to COVID-19, the VA suspended in-person compensation pension exams on April 30th, 2020. The VA determined no veteran would receive a negative claim decision due to his or her inability to report for a CMP exam during the pandemic. The exam requests were held as non-actionable pending the notice of availability. So right now, our national call centers have taken on a project to reach out to all of the veterans that have a pending exam and ask about the veterans' willingness to attend an exam. For those veterans that the national call center members cannot reach, follow-up letters are also being sent to veterans they couldn't reach by phone. And I expect that to go on. Those phone calls, we're trying to reach about 40-something thousand veterans nationwide, and all the call centers are involved. We're working overtime, and I expect that to continue for the next few weeks. The next item I wanted to cover was the Veterans Rapid Retraining Assistance Program, also known as VRAP. This was part of the American Rescue Plan Act of 2021, and it grants funds to the VA to provide training and employment assistance for unemployed veterans through VRAP. Qualifying veterans may receive up to 12 months of tuition fees and monthly housing allowance payments. And those veterans that are interested can apply at va.gov. The next thing I wanted to talk about was to recommend, for those of you who haven't been to the va.gov website, I do recommend you go there. And if you have not created an account, if you're a veteran, you can create an account there. It's very easy to do so. There's lots of great information at that website and lots of great links. Outreach. As you know, we've, as of late, over the past year, have only participated in virtual outreach events. However, we're starting to do face-to-face outreach again. And as the year goes on, I expect us to be involved in more and more events as the year goes on. The next event we are slated to do is the Charlotte Black Pride event in downtown Charlotte on June 17th. We will be there conducting outreach from noon to 5 p.m. Also, I would encourage you that if you are interested to know what we are doing as far as outreach and the types of events we're participating in, we always try to put all those events on our website. If you just go to www.benefits.va.gov/Winston-Salem, you can go to that website and find out what we have going on. So the key takeaways on the VRAP, just remind you that this program, you can go to va.gov to apply, and the program does end on December 2022. and is limited to a maximum of 17,250 participants. The next topic is we've been open to the public for quite a while now. I know initially we were only talking to veterans virtually with public contact appointments, but we are seeing vets in person now. We're seeing veterans who walk in to our facility, and that's not just in Winston-Salem, but that's at all of our sites across the state, to include Camp Lejeune and Fort Bragg. And we've noticed the traffic is increasing. We are continuing to encourage the use of the online Wait While scheduling system for the veterans who want to meet us in person, because that's a great system to use. You can access it on our website that I just went over. You can schedule appointments with our Veteran Service Center or our Veteran Readiness and Employment Division. And you veterans, once they schedule an appointment, will receive a call, because a lot of times we're able to solve whatever issue they have virtually, and they don't have to spend money on gas to come in to our regional office. But for those who do want to come in, we welcome you with open arms. That's all I had. I had one more thing I wanted to bring up. Right now, the VA is actively promoting and reminding the public about VA aid and attendance or housebound allowance. The benefits provide monthly payments added to the amount of monthly VA pension for qualified veterans and survivors if they help with daily activities or housebound. While this particular VA campaign is more focused on pension, veterans who are 100% service connected can apply for housebound and aid attendance as well. For more information on this, again, go to va.gov, talk to your local veteran service officer, or you can make an appointment with us at the regional office and we will go over this program with you. That's all I have for today. I thank you for your time, and we will see you next time.
Brian, thanks, sir, very much for your update, sir, and our best to everyone in Winston at the Vero. Next up, we have Lisa Shear, who will be stepping in for Vision 6 to provide the updates for the Veterans Health Administration side. Lisa?
Good afternoon. Greetings from Vision 6. If we could go to the next slide. For a COVID-19 update, I'm very pleased to tell you today that our inpatient census for COVID positive patients is the lowest it's been in months. For the month of June so far, we have been below 10 cases hospitalized per day. And I'm proud to say that actually today, our inpatient census for COVID positive patients was only 1 in North Carolina. So that's great news, considering that just 6 months ago, we were well over 100 per day. Also wanted to continue on as far as vaccine demand has slowed down, but outreach is very much still a priority for us. Vision 6 has had decreased demand for the vaccines. However, we are still ready and have the ability to provide vaccines to veterans and others eligible under the Saving Lives Act. And so we are reaching out to enrolled veterans at least twice if we don't know their vaccination status, to encourage vaccination. And we are doing that via telephone, text, and/or letter. Facilities continue to engage with our community organizations for opportunities to vaccinate veterans and Save Lives Act eligible recipients, and also for vaccine donation. Vision 6 is actively engaged in the redistribution of vaccines within our network, dependent on the needs of facilities. And we have partnered with the North Carolina Department of Health and Human Services to allow participation of veterans and the Saves Lives Act eligible recipients and our staff who were vaccinated at a North Carolina VA facility to the North Carolina Vaccine Lottery. For the month of June, each June, the nation celebrates lesbian, gay, bisexual, transgender, queer, and other identities, otherwise known as LGBTQ+ Pride Month. VA recognizes the important contributions of all who have served, including the LGBTQ+ community. All veterans should have access to a safe and welcoming environment, not only in June, but every day. This year, VA is offering Virtual Pride 2021, which is a grassroots initiative to educate, enrich, and share. The event began on June 1st and continues throughout the month of June virtually on Microsoft Teams and is marketed through GovDelivery, email, and social media. Moving on to transgender surgeries, the VA secretary announced last week that VA may begin performing gender confirming / affirming surgeries. We will continue to perform the same necessary procedures currently authorized while awaiting further specific guidance and formal changes for the transgender policy. We also have a program called Safe Spaces. We aim to create environments that everyone feels safe and secure. Our actions, language, and behavior all send messages. We want every veteran who requires medical care to feel confident that they can enter a VA facility comfortably without fear, harassment, and receive treatment and leave the premises satisfied that their needs were met and looking forward to their next visit. For Juneteenth, last week, the president signed legislation creating the Juneteenth National Independence Day, a new federal holiday celebrated this year on June 18th, 2021, last Friday. Juneteenth symbolizes Black Americans' resilient journey to obtain absolute equality and freedom in the United States of America. On June 19th, 1865, more than 250,000 enslaved Black Americans in Galveston, Texas, the last known slave community, were informed that their freedom, their birthright, had been conferred on them by President Lincoln. This marked the beginnings of the long march toward equality. Though as a society, we have come a long way to build equality and freedom, the pain and byproduct of American heritage still lives with us through our actions and in our unconscious biases. It is imperative that we continue as a team to be a voice and an advocate of diversity, equality, and inclusion in all that we do. We can only change the future if we understand and learn from our past. Kudos to our VA facilities for their flexibility and adaptability in ensuring that veteran healthcare still continued even during this holiday. On a sad note, we have bid farewell to Tracy Scala. Last Friday, our acting network deputy director, Tracy Scala, officially left Vision 6. She's done an incredible job in stepping in to support and help move Vision 6 forward over the last 2 years. And it's a bittersweet moment as she ends her detail with us in the next week and moves to join the Orlando VA as their associate director. And most importantly, she's excited to be joining her family again and spending a lot more time with her grandkids, but she will be sorely missed. On a final note for this slide, there has recently been a CPAP recall. The Philips Respironics announced a voluntary recall for certain sleep apnea machines and life-sustaining ventilators on June 14th, 2021. VA's national program offices are working with Philips Respironics to identify veterans impacted and prioritize or install replacements or repairs. Patients are to register their devices in the Philips registration portal or to call Philips at the below number. And agents are available Monday through Friday from 8 a.m. to 8 p.m. More will be following in the future on this recall. Next slide, please. For the July 4th, we have the coming Independence Day federal holiday on July 4th. June is also PTSD Awareness Month. So we would like you to join us for our upcoming Facebook Live event focused on VA's understanding and treatment of post-traumatic stress disorder, otherwise known as PTSD. Among veterans, specifically those experiencing or at risk of experiencing homeless. To join, visit the National Center for PTSD's Facebook page on June 30th at 3 p.m. Eastern. Vision 6 and all VHA is going through a safety stand down that is being held from June 14th through June 30th, 2021. The focus of this safety stand down is for all organizations across VHA to consider the underlying cultural, procedural, and systemic deficiencies recently identified in the VA OIG's reports for Clarksburg, VAMC, and Fayetteville, Arkansas. The VISN 6 safety stand down discussions have touched on all throughout VISN 6, including virtual town halls, clinical case study discussions, cascading administrative and clinical team discussions. The overall goals are intended to use those lessons from the report to guide discussions about vulnerabilities that could exist in our own systems. We want to communicate staff members' responsibilities to speak up when things don't seem right or go wrong. We want to share tools for escalating risks and reporting close calls and safety events. We're reinforcing the value of teamwork, mutual respect, clear communication, and inclusion. And lastly, we want to reinforce just culture principles and the use of just culture tools, ensuring leaders improve staff members' psychological safety by not defaulting to blame. We plan to continue to capture strong practices, concerns, barriers, and improvement ideas shared by staff and teams to bring this discussion back to the healthcare system, as well as VISN 6 and national leadership. Just a little public service announcement. Welcome to hurricane season here in North Carolina. Has marked the official beginning of the Atlantic hurricane season. This year's prediction is for an above normal season with 13 to 20 named storms, 6 to 10 hurricanes, and 3 to 5 major hurricanes. These storms can be dangerous and can cause major damage due to storm surge, wind damage, and flooding, and coastal areas might suffer from this, while being impacted also from high winds and river flooding or flash flooding, loss of utilities, and concerns with travel. Please follow all guidance and evacuation orders provided by your state and local officials. VISN 6 has several standard preparedness activities and exercises that we go through each year. All of our sites, including the VISN headquarters, have comprehensive emergency management plans, programs, and officials. We have resource and asset caches locally and nationally. We have the DEMPS program, which is a disaster emergency medical personnel system, which is a deployable workforce. We have evacuation plans that are already developed. We have an incident command system that is tested regularly in emergency operations centers, which we partner with the state of North Carolina as well. The VA also has an emergency alert and accountability system that we have exercised this month. And we also operate from an area of command concept at the VISN headquarters and expand as needed throughout the state. A hurricane plan should be part of everyone's overall personal preparedness plan. And so knowing evacuation routes for where you live, gathering your supplies, and not forgetting about pets, or if anyone in your household has a disability, determine if you'll need additional time to evacuate or if additional help will be needed. North Carolina did recently adopt coastal evacuation zones, and this is very important for our coastal clinics. If you live or work near the coast of North Carolina, you can click on the site Know Your Zone to learn what zone you're in. There are lots of great resources out there that provide information on hurricane preparedness, such as ready.gov, the National Weather Service, the American Red Cross, and even OSHA. The last element on this slide is about BTSS, Beneficiary Travel Self-Service System. We have been implementing this new travel reimbursement system for about 6 months or so. You may recall that we announced progress on the backlog last month, and now we are up to speed on the transition. The perspective for most veterans is that change might be difficult, but ultimately the switch from VISTA beneficiary travel claims processing to the beneficiary travel self-service system will put the veteran in control of receiving travel payments and not leave it up to the facility to take the actions. The VISN has listened to veteran complaints about the system and have made numerous improvements to the program. The most recent update took place this month. For example, they have streamlined the veteran login by adding ID.me and the My Healthy Vet login options. They've loaded veteran payment information into the BTSSS system to stop claims going into manual review and slowing things down. And this will help improve the timeliness of claims processing. Veterans who use paper will also be entered into the system and updating the veteran mapping and mileage system. This is updated software to improve veteran views. Beneficiary travel staff at each Vision 6 site will work with the veterans on establishing their profile information and will walk them through the claims process fields. At some point in the future, the option to print a manual paper claim will go away, and veterans will have to process their claims in the BTSSS system. So we hope that they work with staff at their local facility now to learn the new process. Next slide, please. And here are a few important links for the beneficiary travel reimbursement and the COVID information on VHA's website. Thank you.
Thank you so much, Ms. Shear, for your updates and comprehensive information about VHA programming this month. Moving right along, next up, I'm delighted to introduce Dr. Michelle Laws from the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. And would you like me to click for you, ma'am?
If you just tell me, just go that way, right?
Yes, ma'am.
Okay, thanks. Thanks. It's a pleasure to always be a part of the governor's work group. And I have just a quick little story to share. So today DHHS is having a kickoff rally for the vaccines with the president. And I was printing out my ticket because it's invite only, you know how they do all of that stuff, right? When the president is scheduled to appear. And so Chief Deputy Secretary Kinsley was sending out the reminder to make sure you gotta have your ticket to get in. And I printed it out and I was like, I can't go see the president because we are honoring our visionaries today. So, I'm sitting out on the president to honor our visionaries, and I also said that Jeff would have my head if I did not show up, but it dawned on me that it's the same time. So I did let Chief Deputy Secretary Cody Kinsley know, and he says to tell you, Flo, hello, and send his warm wishes to you. So I'm here while other folk are getting ready to salute the Commander-in-Chief and to welcome him as he is a part of our vaccine kickoff rally that's taking place. So really quickly, we are seeing positive trends, and we know that it is attributed, those trends are attributed to people getting vaccinated in our state. The 3 W's, yes, but most likely there's a direct correlation to people getting vaccinated and us seeing the trend spiral down, which is the direction that we want to in terms of cases and hospitalizations. We know that there are different variants out there, but I often tell people when they ask about the different variants, the Delta variant, that this virus mutates. And the way in which it is mutating is among hosts. And people who are not getting vaccinated are more likely to be the host of the virus and contribute to its mutation. And so, and therefore its spread. And so it's important that, as Chief Falls said, for everybody who are able to get vaccinated so that we can continue to see the trend go downwards. So this is the data as of the 22nd. 463 people hospitalized, 13,382 deaths, unfortunately, is the death total for our state today. And again, this illustrates the trend that we want to see in terms of daily cases. It is moving in the right direction, but we need everyone working together to help us stop the spread and ultimately arrest this virus that's making its way in our state, across our state. This is some data that just simply shows where we are with getting people vaccinated. So about 45% of the total population has received at least one dose, and about 42% of our population has received, whether it's a 2-shot vaccination or the Johnson & Johnson, but 42% of the total population are fully vaccinated. And this is just a breakdown in terms of demographic data. We are so glad to see, and in terms of the 65 plus year olds, because we know that that's also where we're seeing the highest deaths. And so it is extremely important. And we're excited to see this number, hope to see it grow and eventually, hopefully, reach 100%. But we also know that we have quite a bit of work to do among our younger population to get them vaccinated. And so if you are a parent, a godparent, related to any child that you have an influence over, we're encouraging you to get informed and educated about the vaccine and its impact. I know there's a lot of interest and concern about some of the findings and cases related to forms of heart disease or disorder from those that have been vaccinated among the younger population. But we encourage you to always visit our website, dhhs.gov website, or CDC for the most up-to-date information. And do not rely solely on social media, but go to trusted sources such as the CDC, DHHS at the federal level, as well as DHHS at the state level. This is what it looks like when you look at the data from a spatial or a geospatial perspective, when you look at where people are who've gotten vaccinated, which counties are doing a really, really good job. That's the dark blue. And which counties need to do a little bit better and may need a little bit of help. That's the lighter blue. And I always frown because I'm a Tar Heel born and bred and even went to Carolina undergrad. I'm one of the few true natives born and bred in Chapel Hill. So whenever I see anything approaching light blue that has a negative connotation, I'm thinking, come on people, let's get together so we can turn that dark blue. And then of course the dark blue symbolizes the blue devils and so forth. And to inspire, encourage people, there is an incentive. The governor announced this a couple of weeks ago. And that is the $1 million summer cash drawings. And I want to be clear that it's not just for people who are registering to get vaccinated now, but it's for people who've already gotten vaccinated. So take your shot to get your $1 million. And so this is, you can find more information at covid19.ncdhhs.gov/bring-summer-back. And register. The drawing is next week, so make sure that everyone is, who can and is eligible, and that means that you've been vaccinated, that you enter into this drawing. I wanted to share something that I had not been sharing before, but that I will sort of continue to include. And that is, sometimes people may say, I think about the Sesame Street little game and song, one of these things is not like the other, one of these things is not the same. So we get the VA, we get the military, Division of Military and Department of Military and Veteran Affairs, and then we drop in DHHS. And so I just wanted people to know that we too, and if you're trying to figure out why we're not quite like the same, DHHS, we serve veterans and military family members. And particularly, and I've spoken about this before, those who are who do not qualify for whatever reason for their full military and veteran benefits. And so those are people, the category that I talk about frequently and that I discuss with Jeff that, we got to do something are the other than honorable discharges. And largely because when I looked at the data in terms of why people can get that discharge designation, or some of it was alarming. So people who have SMI or who have an experience, a traumatic experience that results in a behavioral health problem that's perceived as warranting an other than honorable discharge. So there were different data sets that I've looked at and information that I've gleaned that makes me really concerned about this population, and they do end up in many instances in our system. And so this is what the data looks like for 2019. We invested over $13 million in services. That's through Medicaid or state-funded services. single stream funded services. But we also, and what's not included in this, is we support programs. We're so glad to support the work that Brandon Wilson does out west. And so we support programs through our block grants as well that serve our veteran populations. And these are just some of the services that we provide from our 2019 data. And then this is the 2020 data. And just to give you an idea of where we ended the year last year. And so we served over right at 3,236 persons that are included among active veterans or military families. And a lot of that work, all of that work on our side is coordinated and managed by Jeff Smith. So I definitely want to take my hats off to him for the work that he does. And for keeping me up to date about what's going on and making sure we're focusing on the right things. We continue to encourage people to utilize these resources if they are struggling with a behavioral health condition of any kind. Use our Hope for NC helpline, 1-855-587-3463. Of course, NC Vets is also available, as well as a host of resources that are there on the screen. Other resources you can find at nc.gov/COVID-19, and want to put the final plug in, either Vax Up or Mask Up. Thank y'all so much. And PTSD month is June, so thank y'all so much.
Thank you so much, ma'am, and thank you for being here.
Yes, thank you.
We'll have to get you connected with the president at a later date.
That's right.
I'm counting on you, sir.
Next up, we've got Victor Glover, who is our State Director for Veterans Employment Services, runs NC Works Veteran Services. Victor, are you with us, sir?
I am present and accounted for. Thank you, Jeff. And just to give everyone a heads up, if I'm not here next month, I think I'm the one who won that $1 million. I'm just saying. Good afternoon, everyone, and congratulations for your retirement, Dr. Fang. Division of Workforce Solutions, NC Works Career Center staff, we have all transitioned back into the offices across the state. Some of the centers are serving customers in person. That's very few centers are doing that. And others are still working with our clients virtually. Next slide, please. We have adapted, of course, in the pandemic to doing virtual services. And we're still encouraging people to use virtual and remote services as much as possible by calling or emailing the NC Works Career Centers rather than coming in, even if their local center is open to the public again. Centers are maintaining public health and safety through protective personal equipment and social distancing guidelines. Next slide, please. Through our virtual services, we're still working with employers, and employers can continue to contact our business services representatives. They can continue to access resources to support hiring and training staff. A lot of our centers are still doing what they call drive-through hiring events, working with one-on-one with employers and setting up hiring events. People are coming through the parking lots, filling out applications, doing interviews. They're doing a whole lot of outside the box thinking with employers and agencies to get people employed in their respective areas. They can continue to advertise employment opportunities on ncworks.gov, locate labor market information and data tools. And even through these tough times, employers are hiring. Help wanted signs are everywhere. Our job board is flooded, but it's not overflowing. We're opening on you can check out the openings on www.ncworks.gov. And through virtual services, individuals can still connect with team members, get help with resume preparation and online job applications, job ready skills, interview skills, find out about local hiring opportunities are still available. And again, for job search, ncworks.gov. we have embarked on a pilot program with our partners in Department of Labor. Department of Labor's Employment and Training Service has contracted employment navigators that will provide interested service members and their spouses with one-on-one and personalized career assistance services at their installations. We have designated a team in the state of North Carolina to work with the employment navigators scattered across the world. Next slide, please. This pilot program includes Naval Station Norfolk, Virginia, Camp Pendleton, California, Joint Base Pearl Harbor, Hickman in Hawaii, Marine Corps Air Station Miramar, California, Fort Benning, Georgia, Fort Sill, Oklahoma, Cherry Point, North Carolina, Travis Air Force Base, California, Joint Base Charleston in South Carolina, USAG Bavaria, Germany, Commander Fleet Activities, Yokosuka, Japan, Kadena Air Base in Okinawa, Japan, and Camps Butler, Hansen, Kinzer in Okinawa, Japan. Each one of these locations has a team of navigators that are working with service members that are returning to the States or crossing over to coming back to North Carolina. And they connect with our team directly, and our team will connect them with the Career Center that they're closest to the location that they want to go home to. And we start working with them with employment opportunities, connecting them with employers, community resources, just rolling out the red carpet for those that have notified us that they're coming back to the state of North Carolina. And list of resources that we use and we encourage others to tap into is NC for Me, North Carolina Department of Military and Veterans Affairs, North Carolina Department of Commerce, NC Works Veterans Portal, and Military One Source, and of course, for listings of a center in your local area, www.ncworks.gov. And as always, this will be on the Governor's Working Group website. We continue to get folks that reach out to us monthly about additional information. So we appreciate the Governor's Working Group for what we do and how we're doing it across the state. And of course, the last slide is my contact information for anyone who needs to reach me. And if I'm not the one who can help you, I will connect you with someone across the state that will be able to provide services and assistance. Thank you for your time. Good day.
Victor, thank you very much, sir. I think we're gonna have to change your nickname to Victor Get a Job Glover. Next up, I've got some brief updates for the Governor's Working Group activities that we do as a matter of fact on a monthly basis. First off, I want to remind everyone, obviously, that June is PTSD Awareness Month. And here's an infomercial or infographic from the VA about what PTSD is and is not. It dispels some interesting myths, so please take a moment to look that over. It'll be available after the presentations on our site, ncgwg.org. Operation Home. Our Operation Home meetings take place on the fourth Thursday of each month at 10 a.m. And that is an ongoing activity between the Coalition to End Homelessness, the Division of Mental Health, and our VA partners to try, and other folks that present on a regular basis, our community partners and the like, to try and maintain our 10-year downward trend in veterans homelessness. It's quite a crowded room if we get everyone in, and our plans right now are to try and get everyone in that room in the month of September, and there'll be more information coming up soon about that. But you just see some example here of the players that are in this space. On the federal level, we've got 4 players. On the state, we've got at least 5, plus the continuums of care in all of our major urban areas and the balance of state COC, which makes up the remaining 86 or 88 counties. And then the multitude of programs that VA, DOL, and HUD put forth to help house folks, as well as some veterans housing programs that we have helped to develop here at the Division of Mental Health and our friends at Veteran Services of the Carolinas. All right, one of our ongoing exercises is the Ask the Question campaign, and I just want to briefly visit that. if you have Ask the Question posters, they're not doing any good in your car or on your desk. Please get them out to our community providers who do not deal with veterans on a day-to-day basis. This will not only help educate them, but also their veteran clients so they can volunteer the information if they're not asked. All of this is in support of our veteran suicide reduction efforts, and on the middle of the screen you will see our toolkit that is available to communities that are seeking to provide a community nexus to found an organization that helps veterans in your community, because solutions are all local. So caring neighbors and friends is what saves people's lives, and I know the folks in this room have no doubt about that because they practice it every day. I know this from working with them for these last years. What does this mean? It means access to training. We've got a multitude of trainings out there through every department and division involved in the governor's working group that will help you gain more skills to be a better veteran service support person, whether it's personally or professionally. It also gives you more access to assistance through the Veterans Administration, the vet centers, our nonprofit partners at the Stephen A. Cohen Clinics for Military Families, our friends at Workforce Solutions, as Victor just told you, have a multitude of programs for veterans. Our NC Care 360 and NC Serves effort, which we're going to hear much more about here shortly, that is our state's 100-county resource center for all of these social determinants of health outcomes that help raise the quality of people's lives and ease the burdens on them. And we also have multiple caregivers programs. These programs are not just for veterans, they're also for the people that love veterans. One of those programs that we are delighted to work on with all of our governor's working group partners is our Welcome Home video series, which is going to be a fantastic point of view video series of brief 3 to 4.5 minutes segments that will walk veterans through the transition process briefly, easily, and it's going to be they're being designed to reduce the anxiety associated with seeking help. We all know, we've had these conversations, nobody's paying attention if they should in TAPS, and then they get home and 3 to 6 months later there's an emergency. So this is designed to put out some of that fire, make it easier for people to seek help and understand what they're going to receive when they walk into your doors. So to all of our partners, thank you very much for bending over backward to accommodate our filming schedules and designing scripting that is going to be, this is going to be a first in the nation project, and we're going to all be very proud of it when it's done. And that's all I have to say about these brief updates. You'll hear more from me in a bit. I did want to throw in our latest numbers here from the governor's working group REACH, and we will see. Zoom fatigue is a real thing, which is one of the reasons we've joined back, to make a virtual meeting here. Folks want to get out of the house. The vaccinations are working for those folks who've been able to take advantage of it, and we're down to about 6,000 a month on average. We'd like to see our participation get back up to 10,000. So any suggestions, please shoot them in on Facebook. Costumes excluded. Next up, I am honored and delighted to present to you all Sergeant Major Paul Berry and Laquana Palmer, who is the manager of our NC Care 360 and NC Serves merger efforts. So thank you so much.
You want me to do the clicker?
Yeah, you could do the clicker.
I'll
Let's
do
have
the
some
clicker.
fun.
We're gonna fast forward through quite a bit right here. Get you a little bit of time back, Jeff. That's what we always do.
Oh, yeah.
So, hey, what brings us here today? But hey, if I'm a retired sergeant major, I got the podium. I have to run my mouth for a minute. One of the videos that Jeff mentioned, I've been a part of that, and it's making a difference, Jeff, and I appreciate that. The work, the funding, the people behind it, Dave, it really does matter when you can get up there with experts and speak passionately and get veterans connected. And Dr. Laws, I had to thank you for the support of the Department of Health and Human Services. Seriously, behind the scenes, it's a machine, it's a big machine, and you're making a lot of good things happen. And then also with NC Care 360 and NC Serves is our partners, all the partners out there, and also the funders too. We don't have a lot of time to get to that today, but to do it, and then I'm gonna steal it again for a second, is Dr. Fang, you're one in a million. But Flo, Susan, I'll put you in there, and I know Dr. Cutler had to go out there too, that, you know, we all need mentors, and you've mentored me in 1,000 ways, and I greatly appreciate that. So why are we here today?
Yes.
Well, I'll do some slideology right here. So, and I'm going to bounce around a little bit because we're a little bit behind on time. But hey, NC Serves was, you know, we started in Charlotte in 2015 using the Unitas platform, and when we spread it up to Raleigh, we took it up into the mountains, and then we took it to the coast all the way through the 2015 to the 2017 time. And one of the things that validated it, unfortunately, was Hurricane Florence. And I tell that story, and it's off script a little bit, that we had to shut down the coastal network, transfer it to Brandon's team in the mountains, and you didn't even know it. And I sat back and was like, whoa, this is a cool thing. Because the veterans didn't know. They were in shelters in Chapel Hill, and they were in shelters in Winston-Salem, and they were talking to people and getting connected. And it was amazing. So I think that opened some eyes. I know it opened my eyes. So it naturally, you know, with the great work that we were doing, NC Care 360 started to come around, and I was like, what is this thing? It's pretty cool. And I started, you know, the original grassroots outreach, you know, I was part of that.
Yeah.
And with Georgina Dukes, and I was like, this is going to work. So naturally it came about, and then of course as of July 13th, I'll go to the end slide already. You know, we're joining forces right here, but I'm going to let Laquana speak. She can speak much better than I can.
No. We talked about this quite a bit. We actually used this slide set with our community chats that we had just recently, where we shared information about the merger that we have with NC Service and NC Care 360. One of the great things that we definitely want to share with many of the communities that are serving our veterans and our military service members is to let them know that a lot of the things that we're doing with our merger is not going to change. The same way that our providers were accessing NC Serves, they'll be able to access NC Care 360 the exact same way. One of the great benefits of being sure that we have these two mergers coming together is the fact that we're breaking down silos. There are so many times that I've worked in, prior to my role serving as the senior program manager for NC Care 360 with the Foundation for Health, Leadership, and Innovation. I was with NCDHHS with Dr. Laws. So serving in the Secretary's office and seeing so many things happening, we always know and see that there's so many different silos where we're fragmented. And because of the interoperability of NC Care 360 and NC Serves, we have those two different networks coming together to ensure that we're breaking many of those walls down. Next slide.
You're going to take us to that video.
Oh, yes. Now that takes me right into the video.
Let me back. I'll pause it.
Okay.
I'm going to tee that up.
Yes, so this is Secretary Cohen, who has done amazing work and has been such a great supporter of the work that we're doing with NC Serves and NC Care 360. And her support has been critical in ensuring that not only do we have access to the health and human services, but we're looking at our community-based organizations who have access to housing services, transportation services, food and nutrition services, and we're also looking at interpersonal safety as well. So as we have that different access, she's been such a huge supporter, and this video shows a lot of her support that she has for us.
Yeah, and what I like about this video is you can't put a timestamp on it. She knocked it out of the park.
I'm particularly proud to have NC Care 360 in all 100 counties of North Carolina as of this June. This is the nation's first statewide platform that bridges healthcare and human services. And I know NC Care 360 is going to be a great new resource for veterans and for all North Carolinians. In fact, the development of NC Care 360 was pioneered through NC Serves, that care coordination networks that's used for veterans and families. And it was supported by our Division of Mental Health Services. So both NC Care 360 and NC Serves are powered by the Unitas platform. We're currently working to merge those networks and databases together to better support the care of veterans in a coordinated model, which over the past 6 years has assisted with 16,000 U.S. veterans and family members and with over 40,000 individual assistance needs.
How about that?
Awesome support.
Yeah.
Yes. And even with that, the joining of forces, you know, one of the great things is that, yes, we're serving our service members, and we're also serving, you know, our veterans, but those veterans, they have people that they love and those community members that they're a part of. So the fact that we have the two, you know, mergers that are coming together is absolutely incredible to ensure that we're serving all of our families.
Absolutely. I'll hit a little bit here for, you know, what's staying the same. Well, the high-touch coordinated care that we're already doing, that's not changing at all. If anything, it's going to get better.
Right.
Because we have greater access to resources. We're going to save time. We're going to save staff hours. And it's also going to make a better experience for the veteran and their family because they have more open doors on there. So the coordination centers will not change. High touch, you're going to come in, you're going to be welcomed in. Thank you for your service. What do you need? We're going to work with our great partners from Commerce, NCGWG, our VSOs, all the nonprofits out there. The great work that Brandon Wilson and his team is doing. None of that is going to change. We're only going to get better together with that. How you access the network is not going to change. If you have a login now for NC Serve Central Carolina, Metrolina, NC Care, it's not going to change. You don't have to worry about taking some new training, getting something else registered or anything else like that. And the experience is just going to be better. We're combining a few of the NC Serve's networks behind the scenes, but it'll have no impact to you.
Yeah, one of the things I will add with that is just looking at our referrals as we go into this slide, is the fact with NC Care 360, we were able to perform over 129,000 referrals just within a year's time. And so with that and having NC Service coming on, they'll have access to all of those different resources and all of those different providers who are there. So it's just, you know, it's a great opportunity just to expand things even more.
Absolutely. We'll skip some. Nope, I'm going to back up and I'm not going to skip that.
No. I want to make sure we recognize it.
Yeah. Almost skipped this one. That's Jimmy Fisher there on the right. The guy on the left, I think, has an arrest warrant out for him or something, or owes money somewhere. But Jimmy was Army vet, fellow artilleryman, red leg, as you say, at the Army, fire direction center guy just like me. He was the second state director of this. He passed away unexpectedly a while back. He was infectious, but I'll tell you what, I mean, I get up in the morning, and if I'm at the Paul Berry pity party, I think about Jimmy and what Jimmy would do and say, and he'd be like, come on, let's go, get your pack, let's go.
Let's get moving.
Let's get moving, let's get to work.
Yeah.
Let's get better together today. So he is really missed, and boy, did he make an impact in a short amount of time. And when we honored him here downtown in the church in Raleigh, people came from all over the country. And our executive director at the Veterans Bridge on Blake Bourne actually served with him and it really impacted him. But his impact is lasting and enduring. We're skipping a lot here.
We're skipping quite a bit, but we do have these slides available. Like I said, we did have community chats, so we went through all of these slides. There were hour-long community chats. We had 2 community chats and a training on top of that to talk about the best practices of using the network. So you're not going to miss too much. We still have that information available.
We're getting ready around the corner here. You know how to get a hold of me, get a hold of Laquana, get a hold of NC Serves. We're hanging, these slides are out there, they're going to be hung out there.
Absolutely.
The
Videos
more
as well.
direct engagement we have, we encourage it. If you're an organization, an individual, if you're an organization that is not part of NC Serves and NC Care 360, reach out to us. And there's no wrong door. Like if you call her in your military, it's no wrong door. You call me and you serve the general population, that's not a wrong door. It's the right door together. So what are we doing? If you're already out there, or if you're new, I would think, you know, hey, workflow discussions are important. If you're a large organization or a small one, you're coming in, those are the most important discussions is, okay, I know what you do. When we come together and we use this thing called Unite Us, how does it flow? What are we doing? It's important to get that, schedule that, you can reach out to do it. If you're an existing organization, is take a look at your organizational update form. So you have a profile in Unite Us, it's called, it says who you are, what you do, what your qualifications are, you know what it is. But take a look at it. You should probably look at it about every 90 days anyway, but as we come up to joining forces, I think it's more important to say, hey, I've got a program that can serve veterans, or vice versa. Hey, I'm a nonprofit, I predominantly do veterans, but I could do this too.
Right.
You're going to add that program and you're going to get better. The community's going to get better and more robust as we bring it together. And then always consider, you know, training. I'm a Marine, you know, we're always training. The additional software training is, you know, more training. I do the user training about every 6 months to be grounded in the basics of the grassroots of this work is who's using Unite Us day to day, right down the road, at a coordination center, an NC Care 360 navigator and stay grounded in it. So there's always opportunities, but there's opportunities for other training that we can scale and tailor as you need to do. And then of course the official launch date is 13 July.
Yes.
And gee, I think we're almost to the end. So there's our contact information. It'll be hung out there. I think a lot of people on here know how to get a hold of me. If they don't, they get a hold of Jeff or Brandon or someone else or vice versa. And again, there's no wrong door here. You get a hold of Veterans Bridge Home, Veterans Services Carolinas. Those are the two quarterback groups doing this. And same thing here, one more.
Yeah, so this is our community engagement manager map, where you'll be able to see that we have 5 different regions across the state with NC Care 360. And again, like Paul said, if you're reaching NC Serves, you're reaching NC Care 360. If you're reaching NC Care 360, you're reaching NC Serves. So we're working together. We have these community engagement managers out there, and they are incredible. So they'll definitely make sure that you're getting linked into the not only the network, but the providers as well.
Yeah, and I'll close with saying that of a great software system, what brings it together is leadership and passion and vision. You got to believe, you got to lean into it, and you got to make it happen. And if there was a bump, take the bump. Get all of us, we'll work out that bump, work out that sticking point, and we'll drive forward together. Some of us have been around at the beginning of NC Serves, and you see where we're at today. We should be proud, extremely proud of North Carolina, where we've just come in the last 5 years, 6 years really, I think is when this has really started kicking off, about the time the governor's working group kicked off. So again, thank you very much, Jeff, thank you.
Yes, thank you for your time, we appreciate it.
Thank you so much, Sergeant Major Barry, Ms. Palmer. You know, when we provision services through the Division of Mental Health into everyone's service provision contracts and grants, is written that they participate in NC Serves, because this is how we, as Sergeant Major said, we make it more and better. Next up, we have Dr. Justin Johnson from Hopeway Services down in Charlotte. He is the Director of Veteran Services and late of the Durham VA Medical Center. He's going to speak to us about evidence-based treatments for PTSD. Dr. Johnson.
Johnson, sir. Thank you, and thank you for having me. Just to introduce myself, I've met some people on here, but not probably most people. So I'm a psychiatrist. I actually grew up in Fayetteville, so I'm a native North Carolinian, and I worked for the past four and a half years at the Durham VA in various environments, most recently working in their Iraq, Afghanistan Combat Veteran Clinic. I also continue to serve. I'm a major and a command psychiatrist for command at Fort Bragg, so I'm still in the Army Reserves. And really, over the past several years, I've developed sort of an expertise and interest in what can we do to better improve mental health for military members and veterans. And so the work I do in my civilian role, both when I was previously at the VA and now currently at Hopeway, really overlaps with the work that I currently do in the Army as well. So I'm very excited and honored to be here, both sort of in honor of PTSD Awareness Month, to talk a little bit about PTSD. So PTSD and evidence-based treatments for PTSD is something I think about every day and is really my specialization as a psychiatrist. But also, and at the end, to tell you a little bit about Hopeway's new program for veterans. So next slide. So this, nothing to disclose except that anything I say, I'm sure other people are aware of this, does not reflect the DoD or the Army or my current employer. Next slide. Sir, can you speak up a bit, sir? We're having a hard time with the connection. It's hard to hear me, you said? Yes, sir. Okay. Yeah, sorry about that. Tell me if it's hard to hear. So first, I was going to do a case example. I may skip that just in the interest of time. And mostly what I want to focus on is just a summary of how do you diagnose PTSD? What's the treatment for PTSD? And then I'll tell you briefly about Hopeway's program. Next slide. So good, yeah, so I'll skip that. So people can go back and read the case example, which is sort of a prototypical example of PTSD. Yeah, that's fine. So can you hear me? Sir. You can?
Yes.
Yes. Okay. So in general, PTSD, the term was coined in 1980 with DSM-3. And current diagnostic criteria was established in 2013, but PTSD as a disorder really has been around for for all of human history, or at least as long as humans have been waging combat against each other, which is pretty much all of human history. And so although the diagnostic criteria is pretty recent, we know that this has been with us since then, and we know that it's going to be with us as long as we continue to fight each other. These are some of the demographics, which I won't read to you. A general takeaway is estimates vary, but roughly sometimes up to about 25% of combat veterans will go on to develop PTSD, although the exact percentages are not fully known at this time. Next slide. So when making a diagnosis of PTSD, the first criteria really is you have to have had a trauma. So post-traumatic stress disorder, you have to have had some type of what we now consider a life-threatening serious trauma. So if people come saying, I have PTSD from my mom would yell at me, that doesn't count as a serious enough trauma to develop PTSD from that. So you have to have something like being shot at in combat, or being raped, or getting into a car accident. Something that's a serious, life-threatening traumatic event is the first criteria. Then after that, next slide. So there are then 4 different types of symptom domains that you have to make a diagnosis of PTSD. The first are what we call intrusive symptoms. So these are things like people commonly hear thinking about, like nightmares or flashbacks. So feeling like you're taken back into whatever the trauma was. The second criteria to have PTSD are avoidance symptoms. So this means somebody says, like, I never talk about that again, or I avoid talking about, or I avoid watching war-related movies, for example. If you have avoidance of reminders of the trauma plus these other symptoms, you might have PTSD. Third, patients with PTSD will develop negative thoughts about themselves or about the world, and or negative moods. So things like depression or anger episodes, anger outbursts, or negative thoughts, things like, the government can't be trusted, or I'm not comfortable going out around groups of people, things like that. And the fourth symptom domain are what we call arousal or reactivity changes. So this is like the hypervigilance people might think of. So like a car backfires and the person drops to the ground, or sitting with your back to the wall and always scanning and looking around you. That's what we call hypervigilance. That would not be normal in a safe environment. And if you have the other symptoms, you might have PTSD. Also sleep disturbance. About 90% of my veterans I see have sleep disturbance, really starting after deployment. And so that would fall under this fourth sort of symptom domain, we call it. So you have to have these symptoms more than a month after the trauma. Plus, this is true for any mental health disorder. It has to be a disorder. So it has to be causing you problems. If you have all these things and you're not having any problems from it, then it's irrelevant and we wouldn't call it PTSD. And then the last thing is it has to not be caused by something else. So like substance abuse or depression or some other medical or psychiatric disorder. So that's the overview of generally how you diagnose PTSD. Now, next slide, I'll talk about first, before I talk about that, just something to highlight. Very common in combat veterans is something we call moral injury, which is when you feel like you've done something to violate some type of deeply held moral belief. So commonly killing somebody, for example, or killing women and children, you can be left with what's called moral injury, which is essentially a scar where you're permanently thinking about it. And that can become part of PTSD and can be, unfortunately, difficult to really treat and move beyond. Next slide. So in terms of treatments for PTSD, I approach, as a physician, I approach every person I see with, as best I can, following what is the evidence-based medical research literature support to help you get better. And if you follow that and you're recommending a treatment to patients with PTSD, you're going to recommend psychotherapy as a first-line treatment. You're not going to start with any medicines. The medicines actually sort of suck for PTSD. And so you're going to try to get the veteran into a psychotherapy, which is a counseling where you talk about the trauma to then get better from it. And the VA and the DoD, as well as really every major medical institution in the world, recommends psychotherapy as the first-line treatment for PTSD. And particularly, the VA recommends what we call the trauma-focused psychotherapies. Next slide. So on the next slide are listed the 3 most common type of trauma-focused psychotherapies that are pretty prevalent within the VA healthcare system. When you get outside of the VA system, it's harder to find these therapies except EMDR, but the first 2 can be difficult to find. So actually, the VA has like a pretty good amount of resources for these types of therapies. Next slide. In addition to therapies, medicines, even though I just said they're not that great, medicines can also help people with PTSD. So these 4 medicines here would be the big 4 most evidence-based medicines that are supported to give people with PTSD. 2 of them are FDA approved. In addition to these, though, lots of other medicines can be helpful. And this is really where it takes having a nuanced view. And what I try to do is to really to scour through the evidence base to find the best and most appropriate medicines if they're necessary for patients. Some other things to take away, you can read down here at the bottom. Really, we should be avoiding medicines like Ativan, Valium, Klonopin, and Xanax in people with PTSD for a whole host of reasons that I could tell people if they're interested later. And also anybody with PTSD, particularly veterans, should be evaluated for sleep apnea. For reasons that we don't really know yet, combat veterans in particular have higher rates of sleep apnea, and that's an easily treatable condition that worsens PTSD. Next slide. The next slide is going to be about really, there's a lot of interesting research coming out. So some of the hot things that you may have heard of are things like ketamine infusion. So ketamine is what we call a dissociative anesthetic. And so it can make people sort of hallucinate, and giving that to patients with PTSD might help them. But also some studies done in our backyard in South Carolina at the VA health system down there, as well as some other places, are psychedelic assisted psychotherapy. This is a book that's about that. There have been a lot of articles in newspapers like the New York Times about it. So this is giving patients LSD or ecstasy in a controlled setting, for example, while they do therapy, has had actually really good, interesting results to reduce PTSD symptoms, including in veterans. So these are some of the things that could be the future of PTSD treatment, but we can't do those now. Obviously, can't give people ecstasy and LSD right now. They're illegal. But it's something that I think we're going to see more and more studies of over the next 20 years. So I just wanted to tell you all also about Hopeway's new program, because I was very excited I love the VA, and I had no intention of leaving. And really, I left because I was very excited about this opportunity about a new veteran-oriented program based in Charlotte. So Hopeway generally has been around since 2016 in Charlotte. It's a residential and intensive outpatient evidence-based treatment program for general mental health problems for people. And about 2 years ago, they became interested in creating a program for veterans, which I was honored to be hired as the director of. And so we opened in February the new veterans program. We can take up to 12 veterans at a time. We are in network with the VA community care referral program. So about half of our veterans we've seen so far have come on VA community care referrals. Veterans stay for about 4 to 6 weeks. They stay at our facility. Next slide. We also are in the Unitas platform if people want to refer through that. But the core of our treatment, I've tried as best I can to set up the most robust, evidence-based, and holistic program for veterans of anywhere in the country. So every veteran who comes here gets access to all 3 of those evidence-based therapies in a one-on-one format. I don't know of anywhere in this area that offers that. So they'll get one-on-one counseling multiple times a week of one of the evidence-based therapies for PTSD. In addition to that, everyone gets seen by me primarily as their psychiatrist for any medicine changes that are necessary. I'm a medicine minimalist psychiatrist, so we don't have to be on any medicines when they're part of our program. We also have an internal medicine doctor who sees people and can manage basic medical problems. We do groups every day. We have art, music, rec, horticulture therapy, horse therapy, pet therapy. We have dedicated exercise time with a gym. We have licensed nutritionists who can craft people's nutritional program for them. We have yoga, we have meditation. We have 24/7 support with an on-call physician who can manage any medical problems that come up for veterans. And really focused on PTSD and try as best we can creating a program that is the most robust PTSD program that I'm aware of. Next slide. So that's pretty much it. I just wanted to give sort of in honor of PTSD Awareness Month to talk a little bit about evidence-based treatments for PTSD, what PTSD is, and also to give a little info on our pretty new program at Hopeway. Any questions for anything we talked about, please feel free to reach out to me. My email is here. Please visit Hopeway's website, which is here. If you have any potential veterans who you think might benefit from coming to this program, they can call our admissions line here. I've also put the contact information for we have a Raleigh area outreach person. Her name is Beth Murgatroyd, who's on there. And with that, I usually would take questions. I don't think we do questions through this, but that's my talk. Thank you all for having me.
We can take them online at Facebook, sir, and we'll forward them to you if they pop up.
Okay, questions, you said? Okay.
we'll be happy to send them to you. Thank you, Dr. Johnson, for your time and your wonderful presentation. As briefly as we could get it through with PTSD, I think that's the fastest PTSD lesson any of us have ever had. But I really appreciate it, and thank you for your ongoing service as well. We'll look forward to seeing you soon.
Sounds good. Thank you all, everybody.
Thank you, sir. All right, next up we have friend of the program, Susan Watkins from the Durham VA Medical Center. She's going to talk to you about NC Strive.
Well, I want to say that all the faces in here have made a major difference in North Carolina. It's this side, right?
Yes, ma'am.
And we're here to honor Lee, but we're going to talk about NC Strive, which was a collaborative that was developed out of all of your all's genius and resources. And it was because our service members were using their GI Bill and they were failing. And they were crying in my office. And Dr. Johnson used to work right across the hall from me. So I'm well versed on PTSD, and success is important to recovery. So we've been combining all of our resources, communicating, collaborating. We do that really good in North Carolina because we're passionate. And this is part of our key to our success. We are losing her. She is retiring, but the part of why I'm here is to say I'm retiring too soon, and we want this to sustain. So we're talking sustainment. This is like a table with lots of legs. The governor's working group is one of those key legs. DHHS is one of those key legs. And then at every VA, there's people like me, and we're now called the Military to VA Case Management Program to make sure those coming out of this generation, this conflict, these 20 years of war, get something that our families did not. And that's part of Flo's and my passion. So we started this by regional conferences. It grew remarkably, and then back in 2020, we had to knock down the bricks and mortar and come into the virtual world. And back at the back, and right here to my right, that's how we built virtual instantaneously in the state of North Carolina. We want to thank you, Amy and Anthony and Jeff. But this year we built 4 virtual conferences with the expertise and knowledge, and we've already reached almost 12,000 North Carolinians and across our geographic area. So people are tuning in. They want to know how to help veterans, and it's really important. Look what was the most important. It's employment. If we can take our veteran resources, our families, get them educated and keep them here, we are helping North Carolina as a whole, and we're helping their family, because underemployment doesn't help a family. So why is this mission important? It's because we're bringing in a lot of money to our school systems. 2-year, 4-year, public, private. Any school can get veteran resources. So it's important. We've done a lot of research. We have a lot of knowledge. Transitions are hard. We've heard it in all the other presentations, the PTSD one. NC serves. When people move, they lose their resources. Those individuals are really linking people to real people and real services. So going to school when you are mature is a hard thing to do. So focusing on success. Amen, you're right. Why? Because there's $400 million coming into North Carolina in GI resources, and part of that is probably, there's more voc rehab monies. Why is this not a mission everybody is passionate about, not just us? So we're bringing you to the table. We are saying, y'all, come on down. We need you to continue the sustainment. It's a great mission. It helps veterans and their families, and it's vital, and we need your help. I just want to say that the next slide is who you can contact. And we love him.
And soon y'all are going to help me.
Because because
Right.
we want to
Oh,
make
yeah.
sure this continues. Thank you so much.
Thank you, Susan.
I know that right.
We are, we will make sure that the work the last 7 years that you and Lee and Flo pioneered and started will continue on. You know, you've been successful in passing it on to a new generation of warriors, and I'll make sure that they do the work. Thank you so much. I'm going to be brief because I know that everybody would like to get on with the rest of their day. We've got a few more things we want to tend to here in the room. But I've been asked to provide just a brief overview of the programs that the Division of Mental Health funds and sponsors in this veteran space. You know, veterans, folks who have worn the uniform and people who are currently wearing the uniform account for 1 in 10 adults in the state of North Carolina. Every one of them has a +1, somebody that loves them. That's 1 in 3 actual voters for any of y'all listening. All right. The monies that we are fortunate enough to be trusted to spend in this space are sent to us from Health and Human Services, and actually it's the SAMHSA portion of the Federal Health and Human Services, the Substance Abuse and Mental Health Services Administration. They have been working very closely with VA and DOD for years, as Flo and Lee alluded to earlier, since 2005 when this conversation started. And it's one of the really most successful team efforts in the federal government. We earlier had a little thank you ceremony for some of the founders of the Governor's Working Group. And this is just a brief snapshot of what we do here at the Governor's Working Group to try and coordinate and collaborate with all of the folks in the veteran space across the state of North Carolina. Our Governor's Working Groups have 10 monthly meetings, today as being one of them. As you've seen, we average between 6,000 and 10,000 viewers a month that are able to access us live on Facebook or through the YouTube channel. We also reach tens of thousands of people a month with our bi-monthly emails on timely subject updates for all of our veteran partners. Our Governor's Challenge to Prevent Suicide has really been a team effort built on the shoulders of the work of the Mayor's Challenge that Veterans Bridge Home pioneered 4 years ago now, I guess it's been. Last year's kind of just there somewhere. But one thing of note of that hard work that our friends at VBH started 4 years ago and did a masterful job of really organizing the city of Charlotte into a very effective collaboration that helped develop our toolkit is that we were recognized last December by the White House Office of Suicide Prevention and Prevents team. And they had said to us kind of rather anecdotally of the states that they had already managed to interview and have their state visits with. We really were head and shoulders above the rest and wanted to know how we did it. And this group, this effort, this organization, if you will, the Governor's Working Group, is how we've done it. And so if you go to the GWG.org website, NCGWG.org, and click on that video, you'll get a brief history of how we accomplished that. Operation Home. We've been working with Coalition to End Homelessness, the Housing Finance Agency, and the VA for the last 6 or 7 years as well to find new, better ways to maximize housing stocks and increase or use every bit of them we can, because despite our best efforts, North Carolina continues to grow, and on any given night there's still 1,000 homeless vets out there somewhere in the woods or in somebody's garage or sleeping in their car. And that's just not something we're going to be happy with on any day. Also, NC Strive that Susan just talked to you about, and the wonderful number of folks that have been participating across the board there. I think we had, 8 community colleges and private and public universities this year collaborate to get the word out on a number of subjects, and so we're certainly going to be working with them again next year. We've already got commitments from a number of them, so no worries there. All right, I talked about veteran suicide prevention efforts, and this is just some of the array of things that we've been involved with. Lots of 3-day Zoom conferences that left us cross-eyed and blind, sorry, Freudian slip. But across the board, with the federal guidance that we received from Washington, the state of North Carolina is well aligned to maximize our efforts and produce results. And you know, this is suicide, something you can't take back. So we are the thing I am proudest of is being associated with this organization that has been able to see that we have the lowest rate of veteran suicide in the southeastern United States. And that our goal is to just dig fewer holes every year. So, short series of videos that we have produced, PSAs for use by our community partners, anyone out there in the state. These are customizable to your individual efforts and available if you reach out to us through ncgwg.org. You are welcome to run them anywhere you wish. Get your media partners to give you 30 seconds to save a life. I'd like to thank Anthony McLeod from the Governor's Institute. He whipped these up on a weekend for us. Good. The gentleman who's the reason you all are seeing us here today, and his partner Amy Johnson, who is probably keeps them sane around here in this virtual world we now live in. So some really good work we've done here, and take advantage of them, please. All right. I spoke earlier about our Ask the Question campaign. You're going to hear more about this for the next year, whether you want to or not. We will have Ask the Question PSAs and longer videos out shortly here. They've been shot and are being produced as we speak. And like I said, our effort is that if you ask, then you get help. My father used to tell me when I was a kid, if you don't ask, you don't get, right? So with 1 in 10 adults in North Carolina having worn the uniform or currently wearing it, there's plenty of customers out there that need some service. We spoke about NC Strive earlier. This really is a broad-based collaboration with education and the VA and the state of North Carolina to ensure that our student veterans and their families get the success that they have worked so hard to achieve and have a shot at. And we really are just deeply grateful for all of our partnering institutions. We spoke earlier about NC Serves and NC Care 360 joining forces, and thank you again for Sergeant Major and Ms. Palmer for sharing some of that information with us. These are dashboards that we pulled up the other day. I guess it was Tuesday afternoon, and as of Tuesday afternoon in the state fiscal year, we'd have over 8,100 referrals in the NC Serve system alone. Those are 8,100 veterans that got linked up with something they needed. And there's a little bit of definition there as to what they were looking for. And you know, of interest, and consistently for the last 4 years that I can remember, it's always housing and shelter and employment and financial assistance, right? We spoke about this at the VA Suicide Prevention Conference, that you know, financial and housing stability are indicators of mental and behavioral health issues. And so rather than looking at them as possibly something else, that if people are having financial and housing stability issues, this is an opportunity to hook them up with the mental and behavioral health resources they need, because that's how you interrupt suicide. That's how you get in the way. You know, we know that suicide is not one thing, it is a cascade of many things. So if you can help them keep a roof over their and their families' heads, you're getting a lot closer to the solution. All right, we spoke earlier about housing and Operation Home. You know, in the last 10 years, we have, ups and downs aside, on average, it has been a 28% reduction in veterans' homelessness. I cannot think that that's going to continue over the next 12 to 18 months. As it stands right now, and when we have not heard any updates, have we, ma'am? Eviction moratoriums are scheduled to expire on June 30th. We know that the non-congregate living programs that put homeless veterans in hotels, HBO is going to run out, and those guys are going to be back out on the street soon. And so we have got to work more closely together and really fill in those gaps, or we're going to see a lot of homeless vets out on the street this Christmas. So to that end, and we are working on finding a date, in September of this year, we're going to have a symposium that talks about this relationship between mental and behavioral health concerns and how they, show themselves in financial and housing stability issues and their relationship to suicide prevention. So please stay tuned for more updates on that. We will have a date and time, and we've got some really solid heavy hitters that are wanting to weigh in on this subject, and let's continue to make a difference through our efforts here at the Governor's Working Group on Operation Home. One of the programs that very, very, very proud of that we developed here at the Division of Mental Health with our community partners at Veteran Services of the Carolinas is the Veterans Hope Program. It was born out of what program called PATH, and this is kind of intensive outreach services for chronically homeless individuals suffering from serious mental illnesses or serious and persistent mental illnesses. And our folks at Veteran Services of the Carolinas have embraced this. They have combined it very effectively with all of their other federal veterans housing programs they currently administer. So they've been able to identify over 585 homeless vets this year and connect them with resources. I know that beyond that, I think it's another 425, 450 individuals who were not veterans who are homeless got put into our NC Care 360 system to help them get a start on changing their lives and getting out of the woods and out from underneath bridges. So this is something that we're all very proud of, that we built it here. Another idea that was built here in this room was the Veterans Life Center, and we're delighted that one of our colleagues, Mark Woodard, is our Director of Programs up there. They are doing great work. They have bed space with COVID restrictions being lifted. They have a lot more bed space because it's not one man a room or woman. They have an entire wing for female veterans that are seeking services. They work very closely with our Alcohol and Drug Addiction Treatment Center right down the road in Butner, and they're 20 minutes up the street from the VA Medical Center. It's a beautiful location, and it's nicer than the college dorms I ever lived in. Please give them a call, vlcnc.org. All right, this is an a relatively old program that was developed by our founders of the Governor's Working Group several years ago to assist our friends in the National Guard with self-medication issues that were affecting performance. We've been really proud of the fact that Brenda Monforti and the folks at Alcohol and Drug Council of North Carolina have expanded it to assist the Air National Guard as well. Here's all their contact information. Please, if you know someone who serves in the Guard or Air Guard who's having a hard time, get them Brenda's information. It's free, and it doesn't report back to the command structure. This is confidential assistance by your friends at the state of North Carolina. More friends from out of state. The Stephen A. Cohen Veterans Network. They administer 2 clinics here in North Carolina, one in Jacksonville at Hope for the Warriors and one in Fayetteville at Centerstone. These 2 administrative partners are doing amazing work. Once again, fully confidential. They will help active duty, veteran, military families. You spent one day in the military or your spouse did, they will talk to you and get you headed in the right direction. These are free services for those folks who cannot afford. They can bill your insurance if you do have insurance. They're really a wonderful part of a larger network of 25 clinics based across the United States that are funded by Mr. Stephen A. Cohen. This is a tremendous gift that he has given our nation. And because they operate in 25 military communities, they are really dialed in on the issues that are commonplace and happen across the country. Their learning tools are astonishing, and we're just really honored that they chose to put 2 of these clinics here in North Carolina. And so we want to say thank you very much to Dr. Anthony Hassan and all the folks at Cohen Veterans Network. Our Veteran Support Specialist Training Program. This is the best training program I've ever seen personally. It refuses to die. The Governor's Institute's own Dave Roddenberry here is one of the founders of that. He and Dr. Moncad, when they were loosely associated over at Duke and working with the VA in Durham, built this thing with some help from the folks at the GlaxoSmithKline Foundation, and we continue to keep it alive. It is really just, I can't say enough about this program. Colonel Falls is one of the original developers that helped dial it in. This is built by combat veterans for frontline service workers to help them have better tools to connect with our veterans here in North Carolina. And every year when I get to tune in or sit in on the room, I am even more amazed at the lessons people get out of this. It really has been saving lives since day one. And if you get a shot to take this class, don't miss out on it, because not only will it change your life, it'll save other people's. And with that, I would like to say that our next meeting will be Thursday, July 22nd. Don't be hurt if you don't hear from me before the 17th, because I'm going fishing for a while. Thank you so very much, everyone, for your time, and have a safe and happy 4th of July weekend. Okay.